Welcome to tonight's live, talking about the hair, scalp, and skin. As usual, I will introduce myself. So my name is Djanie-Hair. I am an advanced hair, scalp, and skin therapist here in my studio in Leicester. And I operate in my studio clinic for dealing with problematic skin types, hair issues, and scalp problems. I'm also a consultant for therapists and professionals within this space of the hair, scalp, and skin who want to advance their knowledge on the craft that we have in this industry, basically. And I also help people who perhaps cannot come to see me but want to engage in trying to learn a bit more about the hair, scalp, and skin from a distance. And we are able to do that through coaching. That is a service that we have newly started doing here within my business, and it is amazing. And so if you want to join us, you can find me on Instagram at Vegan Hair Salon UK, and you can find all the information on there as to how to employ my services. But today we'll be talking about the hair, scalp, and skin. The subject of today is about our hair. Do we actually need hair? Do we need the hair that we have, and how important is it to our health? I'm just going to make sure that everyone can hear me and see me before I continue. Okay. Again today. Okay. Let's just make sure that that is turned down. So our hair, do we need it or don't we? So our hair is a non-essential organ. It isn't the same as perhaps your lungs, your heart, or the important parts of your body that keeps you going and keeps you alive. It's a non-essential organ. We must understand that, because otherwise lots of things become a little bit too difficult if you start to give it more importance than it actually is. The important part of it that we find is the psychological effect of the importance of hair to us as a people, or a cultural sort of importance that is placed on hair, and the fact that it's a health barometer for people to kind of gauge how healthy they are or not. And so usually that is the importance that we place on hair, which is not an issue. The only thing is that in the health in the health department, hair is not an essential organ. It's a non-essential organ that sometimes we have to maintain for the purpose of aesthetically looking good, but it doesn't keep us alive. It doesn't help to keep us alive. Okay, and so the hair goes through a cycle. It goes through the cycle of active growth, resting, and shedding. And then there's another stage where it just waits to transition over to active growth again, right? So we have the anagen stage, the catagen stage, and the telogen stage. That's the active growth, resting, and then when it falls out, and then it rests again, or it has that transitioning period where it's starting the process all together again. At every stage of your hair cycle, we are dealing with each strand of hair. All your hairs do not go into that same hair growth cycle at the same time. Several parts of your hairs are going through any one of those stages at one time. So they're not all going through the same stage at the same time. So not all of your hair is going through the active growth stage. Not all of your hair is going through the resting stage, and not all of your hair is going through the shedding stage. Only parts of them are going through at the same time. So sometimes when you analyze your hair, you'll notice that there are parts of it that are a little bit longer than the others, and there are parts that are shorter than the others. And that's just because some have just been born, some have been living for a while, and some are about to just leave your scalp. Okay, so when we have patients who are particularly concerned about losing hair, some of the behaviors include not brushing the hair. So not doing things because they feel that they will lose more hair. And one of the things is that they don't brush the hair. They think that when they brush the hair and they see strands of hair coming out of their hair, it's an indicator that they're losing hair, and they feel that they can avoid losing that hair by not brushing their hair. But as I've explained earlier, hair goes through its life cycle, a little bit like humans do. We are born, we live, and we die. The hair is exactly the same. It is born, it lives, and it dies, and it waits, and then others come back through the hair follicle. So avoiding to brush your hair or to comb your hair has a detrimental effect in just mechanically managing your hair. So the day-to-day management of your hair relies on you caring for the hair. That means cleansing the hair, that means conditioning the hair, that means brushing the hair. It means just really just dealing with the hair, but in a gentle manner. So you're making sure that you're dealing with your hair in a gentle manner, not with high tension or with, aggression, for example. Okay. So long as you're being gentle and you're handling your hair with care, there's no reason why you mustn't do what the hair needs, which is cleansing, conditioning, and caring for the hair, including combing the hair. Now, we expect to lose on average about 100 strands of hair a day. So everyone must expect to lose about 100 strands of hair a day on average. It could be more, it could be less. But you are the only person who knows whether you're losing more or less or the same as you always have been, because no one lives with your hair but you. And so you're the one that can tell whether you are losing more hair or that your hair loss is exactly where it should be. And so the first things that we notice with clients who complain of hair loss is that they just say, I just feel like there are more hairs coming out of my hair when I brush my hair. That will be an indicator of a hair loss condition. So 100 strands of hair must come out of your hair or your scalp every day. If that is not happening, cumulatively, you'll end up with a lot of strands of hairs that is on your hair that should be coming out, that is not coming out. It has not come out, it has not been combed out, and has not left your hair. And so if you haven't brushed your hair for 3 days, expect that when you brush your hair, there will be more hair coming out of your hair, or the hair brushing activity, than normal. Okay, so you add the days on. And so if someone has had a protective style for say 2 weeks, 2 months, or what have you, when they take their hair extensions out, or they undo the hair, the protective style, they notice that there is a lot more hair fall in their brushes. And so they start to think they've lost more hair, whereby they actually haven't. It's just that cumulatively there is more hair in that brush because you haven't been brushing your hair, and your hair has been held in that protective style for a long time. Or as in the case of locked hair, so when people have had their hair locked, that is essentially what is happening. All of the telogen hairs that have been lost, that should come out or ordinarily would be combed out and perhaps thrown away, in this case, that hair hasn't been thrown away, but it's locked in the hair, and it creates a really nice opportunity for you to fuse the hair together to create the lock effect. Which leads me nicely on to the next point, which is that if you're not brushing your hair to remove your telogen hairs, yeah, so those hairs that have gone through the cycle and have come towards the end of the cycle, those 100 hairs that you should be losing every day, if you don't brush your hair and those 100 hairs are in your hair, yeah, as a bulk, and then you're adding days onto it, you're ending up with many hundreds of hairs in the bulk of your hair that hasn't been brushed away, and henceforth are living there and causing fusion, causing tangling, the same as you would do with locking the hair. Okay, so when patients come in with some hair loss issues, sometimes some of the hair loss concerns are just that the hair itself has just wrapped itself on another strand of hair that should have gone away, that should have been brushed off and thrown and disposed of. But that has not happened. So it's still living in that bulk hair and wrapping itself around the hairs that are still attached to the follicle and causing tangles. And that over time starts to cause an issue for patients who come in with hair shaft disorders and so on and so forth. So avoiding to brush your hair is not necessarily the right thing to do. The right thing for you to do is to make sure that you're brushing your hair at least once a day, just to get those hairs out so that they don't stay in your hair and cause further issues. And sometimes when we just advise clients to do that simple activity can alleviate a lot of issues. So brushing your hair every day will not cause you to lose more hair. Only the hairs that have come to their terminal stage will come out of your hair. No other hairs will come. I mean, unless you're holding onto your hair and pulling it out vigorously with aggression, that is another story for another day. But today we're talking about the hairs that you gently brush out of your hair. Okay. I hope that you understand that, and I hope everything is okay and people can hear me without any issues. And sometimes we have clients who come in to see us who say, my hair's not growing. I don't understand. I feel that my hair's not growing. Not that they're losing hair, but they feel that their hair is not growing. And for clients who say those things, I mean, the advice we give is that for as long as you're alive, you will grow hair of some sort, unless you're completely bald. If you have no hair on your scalp whatsoever, then that is a different scenario altogether. But generally, if there is hair on your head and we can physically see hair on your scalp, then you are growing hair. Your hair is growing. It's going through a life cycle in itself, which is, like I said, born, live, and die. So your hair is in the anagen stage, the catagen stage, and the telogen stage. Okay, so how else do we find out whether people's hair are actually growing? If you're graying and you've got graying or white hairs that you're having to color every 6 weeks or so, your hair is growing. You have got hair that is growing. Okay, so you are producing new hair as you should do. So if a client comes in and they're getting their hair colored frequently every 5 to 6 weeks, we cannot explore the possibility of them not, of the fact that they're not growing hair. It doesn't make sense. It doesn't make sense because they are growing hair. If we're coloring the hair every 6 weeks, it means we're getting new growth coming through, and that person is having a hair cycle that is normal to what we expect. And that also goes for people who relax their hair. So if you're relaxing your hair and you're having new growth coming in that is of the natural texture as opposed to the straightened texture, you are growing hair. Your hair is growing. Okay, so this is just for the hair part. You know, are you truly losing hair? Do you need hair? Do we need hair? And the answer is no, we don't need hair. So it's a non-essential part of our anatomy. It's non-essential because it doesn't help keep us alive. And we don't lose hair just by brushing our hair daily. We only lose what we were going to lose in the first place. You were going to lose that hair anyway. Whether you brush it or you don't brush it, that hair was going to leave your scalp at some point. So, and then the whole scenario of I'm not making hair or I'm not producing hair or my hair's not growing, that is not also true so long as we are coloring your white hairs or your gray hairs or you're having relaxers and we are having to redo the roots at some point, however long you have been prescribed to have your hair relaxed for, then you are growing hair, you are producing hair, you are actively producing hair. There is an active stage, resting stage, and transitioning stage of your hair growth cycle. There's an active hair growth cycle happening there. Okay, so I'm going to quickly move on to the skin and how to avoid losing moisture in the skin. Okay, so I want to talk about transepidermal water loss. That is when you're losing water in the skin faster than you should. So ordinarily we expect that we should lose some water. Some water should evaporate from our skin, from our bodies, either through diffusion or evaporation. Something is happening where we're losing water from our skin. It is normal. It's not the same. It is not the same as sweating. This is losing water from the skin. That is normal. It's called transepidermal water loss. The issue is that when we're losing far too much than we should do, then we are starting to face some issues. How do we tell when we are losing far too much transepidermal water loss? So I've discussed before about the epidermis. The epidermis is this outermost layer of the skin. Okay? And there are layers of it, but the outermost layer of the skin, I beg your pardon, the outermost layer of the skin is the stratum corneum. The epidermis has several layers there. So bear with me and I will show you on my skin anatomy. Okay, so trusted old friend, all these layers are the layers of the epidermis. That is the dermis. This thick area is the dermis. This is where we have all the sensory nerve endings. We have blood vessels and we have so much happening here. We have some fats. We have the erectile pillar muscle. We have the hair bulb right in there, snuggled up in there. But what I'm talking about the epidermal water loss or the transepidermal water loss happens here, which is the stratum corneum, where we lose a lot of water, more than we should, out of the skin on the outermost layer of the skin, which is the stratum corneum, which is this part that we see here of the skin. So we should be losing some water. It is fine. We lose fluids in our bodies through, releasing toxins, making sure that the lymphatic drainage is happening, and so on and so forth. But extensive transepidermal water loss is an issue because it presents itself in the skin in these ways, such as, your skin becomes dry, it becomes flaky, it becomes rough. In fact, you start to notice increased fine lines and wrinkles, and that is normally a sign that you are losing too much water through the epidermis. And how we combat that is by using humectants, which we discussed yesterday, and emollients and occlusives, for example. So we normally go in topically at from the external factor to make sure that we are doing things externally to the skin to stop loss of water. But then we have to deal with it internally also. So we'll come back to that later. And then there are habits that we need to kind of change to help with that from happening altogether. So we use humectants to help with this from the external in, because humectants are great at trapping water at about 1,000 times their own weight. And when they hold on to that water, it helps to increase the hydration levels of our skin. Or we use emollients, for example, cream E45 is an emollient. So anything of that sort of texture or consistency is what we call an emollient, or occlusives such as petroleum gel or petrolatum gels. Okay, and so what are the things that we can do actively in our lives to help us reduce the chances of transepidermal water loss? Some things could be just how you look after your skin in general. I'm talking about the skin all over your body, from top to bottom, or from top to toe. And so some of the things I want to talk about is really looking at the skin as, as a whole. When you're in the shower and you're cleaning yourself, how do you look after your skin to make sure that you're not losing too much water. I don't only want to discuss the skin of the face. I think today I want to focus on the skin of the body as well. So when your skin just looks a little bit, it's just dehydrated, dry, flaky, it's rough, it's starting to show signs of wrinkling, this is what we do. So you go in the shower, you're going to have a shower. The first thing you do is you make sure you keep the doors closed. This is so that we can trap the moisture in the air, and so that we can get the benefits of having the shower is increased by doing that. Okay, so you close the door of the shower and you make sure that you're using warm water rather than hot water. Hot water becomes an astringent. It starts to strip the skin of its oils, okay, and makes the skin drier. So you use warm water to have your showers, and you choose to have gentle cleansers. Gentle cleansers are fairly similar to what we discussed about hair, using the gentle cleansing surfactants, because of the fact that they are there to trap oils and grease and remove it, which is emulsification. It's lovely. We love that. However, when we're trying to retain the moisture in our skin, we don't want to lose too much of the things that we need. We only want to take off what we need and not more than we need. And the fact that we tend to bathe more often, we tend to shower more often, naturally we are going to remove some of those dead skin cells anyway. And so using gentle cleansers is beneficial in this case. And also making sure that when you're finished showering or bathing, you towel blot your skin so that you're leaving some residue of water on the skin before you start to moisturize the skin. Yeah. And because you have shut that door to your bathroom, what's happening is that the moisture is still trapped in the air, and so that you can have the full benefit of having moisture still living on your skin whilst you moisturize. I'll caveat that for people who have silk presses. I'll come onto that somehow in the next few days about certain styles that we do and how we live with them. So if you have silk presses, then this is not for you. But if your hair is natural, or you've got protective styles, or you have a style that you can maintain, or perhaps you're just washing your hair that day, you could do this. You could do this as often as you like, or as inoften as you like, to make sure that you're restoring that skin barrier. Okay. I'm going to talk about what a healthy, hydrated skin should look like. And a healthy, hydrated skin should have moisture, and the uppermost layer of the skin should feel supple, and it should also remain waterproofing. So that barrier, that acid mantle, should still be intact. It should still be waterproofing, and it shouldn't be stripped. Okay. Damaging that waterproofing barrier of the skin leaves the moisture ability to, it gives the moisture the ability to escape from the skin. So that is when the waterproofing barrier is damaged. So our skin is naturally waterproof, and so we want to make sure that it is always maintaining that waterproofing effect. Because if it rains and we go outside, or we have a shower and we immerse ourselves in a lot of water, say when we're having a bath, if our skin didn't have a waterproofing nature, what will happen? Will be filled up with water and become jelly-like and just inflated and just be a big water blob. But that's not the case, because our skin has a waterproofing benefit or characteristics. So we need to make sure that that barrier is intact, so that we can retain moisture in the skin and not lose it, and that the skin does not become dehydrated, dry, and tight. So when you go and have a shower or you wash your face and you notice that your face feels a little bit tight and dry, it's because you are really going too far into stripping the skin, and that will eventually start to damage that waterproofing barrier that is on your skin. Okay, so what are the other things that we can do internally to help us to look after our skin? In order to stop transepidermal water loss, we have to start looking at using products that help us to achieve that water retention or moisture retention desire to our skin that we're looking for. Some of the things that we do in my clinic is to prescribe my patients with the Skin Omegas, which is the Advanced Nutrition Program Skin Omegas. I'm going to caveat this and say that I am not a doctor. I also am not sponsored to speak about these products that I talk about. This is what we do within my clinic, and that is what this conversation is about here. Okay, so the Skin Omegas are amazing, and we prescribe that to clients to make sure that they are dealing with moisture loss from the inside out. What the Skin Omegas does is that it looks after the skin by ensuring that we are increasing hydration and smoothness in the skin. Okay, so the omegas that we have are the omega-3 and the omega-6s. Okay, these are the fatty acids. Now, this is good for the skin in the sense that it really looks after the skin by reducing the anti-inflammatory effects that could happen when the skin is losing moisture. It also improves the skin's immunity and helps it to be resilient and withstand the pressures of the external factors that can really damage skin. And that lovely protective barrier, that waterproof barrier that I spoke about, it also enhances that protective barrier. So you almost can't, you'd have to really try hard to wreck that, because the omegas will strengthen that barrier and help it to withstand the pressures of anything that you do to the skin. Okay, and so it's great. It is great for dry skin, sensitive skin, inflammation in the skin, or problematic skin that just seems to be a little bit more taxing in general for you on a day-to-day. The Skin Omegas are fantastic for that. It has evening primrose in it. It has, like I say, the omega-6 fatty acids and also omega-3s. It is not a vegan product, unfortunately, because it has fish oils in it. But apart from that, it is great for the benefits that I have actually stated here. Okay, so the evening primrose benefits are just fantastic, where it's actually where it derives from, and it derives from the seed of the yellow evening primrose wildflower, and it has got linoleic acids in there. Also, it has the essential fatty acids, as I've mentioned before, which is fantastic for playing the role in the integrity and the barrier of the skin, as I've also mentioned already. So looking after the skin and avoiding moisture loss is so important. And as I say, we make sure that we're improving hydration, we make sure that we're improving any chance of transepidermal water losses, we're reducing the depth of the wrinkles. So if you found that your skin is showing signs of wrinkles and that perhaps the lines are becoming deeper, moving on from being fine to deep, then this is the kind of thing that this is the approach that we would have for you. And it also improves the smoothness of the skin overall. So it's absolutely fantastic. And I just want to recap, unless I have anything more to add. So I'm really struggling with hay fever, and it's a miracle that I keep making these videos. And so if you're enjoying it and you're with me, it will be nice if you say hi just by putting an emoji, and let me know if this is of value to you at all, because this hay fever is pretty hard on me. So just to recap, when you're losing moisture, or you notice that your skin is looking dehydrated, dry, flaky, rough, and that your skin is starting to show signs of wrinkling, and also that those lines are becoming deepened, you are losing what we call excessive loss in the epidermis of your skin. That's what we call transepidermal water loss. So we want to make sure that we avoid things that cause us to be dehydrated, all in all. Intrinsic things that we do would be, or internal things that we do rather, would be make sure we're drinking a lot of water, making sure that we're avoiding the dehydration of alcohol and caffeine, because surprise, surprise, they all act the same. Caffeine and alcohol behave very, very similar in what it does to the skin. It has all the dehydration effects, almost comparable. So we're making sure that we are hydrating and we're avoiding things that dehydrate the skin. We are looking after ourselves from the inside out. The things that we will do would be to make sure that we're taking things like the omegas, the skin omegas from Advanced Nutrition Program, which is fantastic. It has got high levels of the ingredients in there. This is a prescription that we do and we follow through with our clients. For example, it's got the omega-6 and 9s. It's just brilliant in what it does for the skin. And so that is what we do in terms of looking at you from the inside out, or looking after you from the inside out. And then we have other complementary things that we do based on the consultation that we do. You would have to have a full consultation, of course, to make sure that you are going to benefit from this treatment or this treatment plan. Then we look at things that you practically can do at home when you're having your shower or you're cleansing your skin and you're having a bath. By closing the door, making sure that you don't lose any of the moisture from the environment, the moisture droplets that are in the air, you're still taking full advantage of it. Once you've showered, you make sure that you're using cleansers that are gentle. You are using warm water rather than very, very hot water. I love a hot shower, so I speak to myself when I talk about this. I love a very, very hot shower. But to stop the action of losing transepidermal water, we should try and use warm water. Okay, and then when you're done and you're using your cleansers that are really nice and gentle, you make sure that you blot the water off your skin, and then you moisturize as quickly as you can, making sure that the air is still filled with that beautiful moisture that is still elevated, and you finish your treatment like that. So you'll be using things like emollients or hydrators, humectants, and occlusives, for example, depending on the level of moisture loss that we have. Okay, and then one of the things I wanted to talk about is also the importance of hyaluronic acid and things like that. So they are of the humectants that I speak about and what they do, how important they are. I said that they hold up to 1,000% of its 1,000 times of its weight in water. It reduces wrinkles and boosts that elasticity in the skin. It plumps the skin. It aids healing, wound healing, which is just amazing. When there is transepidermal water loss, sometimes what happens is wounds don't heal as well because skin is just so dry. And hyaluronic is just amazing for that because it also stops the reduction of scar formation. Okay, hyaluronic acid is great for the fact that it lubricates the joints and it calms inflammation and also looks after your heart and your eyes. So it's all fantastic stuff. But also, after all that, it makes your skin looks beautiful, smooth, hydrated, full of moisture, the right amount of moisture, and that dehydrated dry and wrinkles are all settled beautifully and restored and replenished. And your hair looks full, youthful, and plump. Okay, so I hope this was of some value. If there are no questions here today, I will end today's live. But as I've always said, please look after yourself from the inside out. I say this to my clients and I'll say it here. It's really important that you have a multiple attack to issues that you're facing. And the hair and skin, that is our extremities. These are the outermost, areas of our bodies that shows how well we are doing, how well we feel, or how well we're taking care of ourselves. And so the hair, scalp, and skin, the whole idea of it is to make sure that when we start to look and see the positives of the way our hair, scalp, and skin looks, as much as the hair is a non-essential organ, we still want to make sure that it looks good, it's full, shiny, and healthy, because it's the marker. If we use the skin, the scalp, and the hair as a marker to our health, we can't go wrong. The moment you notice that your hair is depleting in health, your skin is no longer what it used to be, that is a marker that something else needs to be looked at with detail. And so you need someone that has got expert knowledge who can help you in troubleshooting some of these things to make sure that you're getting the best help that you can possibly get out there. Okay, so consultations are amazing. And if you are looking for someone to help you on this journey to look after your hair, scalp, and skin, you can find me at Vegan Hair Salon UK or at Desiree Djanie on my social media sites, and you can find me there, and I'll be more than happy to help you. Okay, and on that note, love always. I'm going to say good night and goodbye.